Welcome, everyone. I have an incredible guest with me today, Dr. Priyanka Grover. She is a dear friend. She's someone who I deeply admire. She's someone who I met years ago, and I thought, wow, this is a girl I've got to get to know. She's someone who's just happy and bright, and you're always dressing in fun colors. You're always expressing yourself through fashion and through the different things that you do. And I can't wait to dive into today's episode, so welcome.
Thank you, Shivani. I have to say the admiration is mutual. Since we met, I was wowed by your ideas, by your thoughts, by your presentation, by your aura, by the vibes you bring to the room when you walk in. So it's it's my pleasure to be here.
Thank you. Thanks for coming. So it's so funny. The description I have of you in my mind is a light when she walks in the room. I think of you that way because whenever I walk into a party, we run into each other occasionally once or twice a year. I go to these Indian parties that we're supposed to go to that my in-laws throw. And when I go, I always see you and I'm like, gosh, she's always so happy to be here, to be amongst friends, to be out in the community. And so it's always a fun way to run into you.
Likewise, I have a zest for life and I see the same vibes coming from you. So I guess we attract each other in that way. And I believe every time we talk, we bring out best in each other.
Absolutely. Absolutely. Okay. So let's dive into a couple things today because there's so much about you and there's so much wisdom that you hold. And a lot of it is in these areas that honestly I know nothing about. You know that I'm very into health and wellness and well-being. And as women, what do we have to do to prevent disease? And then what else do we have to do to invest in our health in a way that we get to keep it, that we get to thrive? And then, now as women in our 40s, how do we shift with health and well-being in a way that we get to thrive, really rock it at this point, at this junction? When we have kids about the same age. That's quite a journey that we're undertaking. Correct. You're a fellow woman, professional entrepreneur, raising smart, brilliant kids and doing all the great things. You have an amazing husband who I know well. So it's not easy to keep all the balls in the air.
Well, as a fellow woman and fellow entrepreneur and a physician, you know how it is. But it's a very valid and very relevant question in today's world. So
how do you keep it all together? What is your mindset and viewpoint around it?
Firstly, I think over time, I've just realized take it one day at a time, one moment at a time. As we speak about mindfulness and Buddhism, not that I'm a complete devoted Buddhist, but one thing I've learned is mindfulness. If I'm with you here, you have my 100%, right. And that's the only way I can keep going on and do my best. When I'm with my patients, either doing a procedure or scanning them or invested in their results, I'm 100% with them. When I'm with my children, I try my best to be 100% with them. That's one place I'm still working on because there's so many distractions sometimes. Yeah. And whichever we do, let's just focus on that time at that moment.
Yeah, absolutely. No, I think that's a great tip. And it's honestly the only way through because otherwise the sheer volume of what you're trying to manage.
Exactly.
Between house, home, business, team, staff.
Exactly.
The kids, the husband, the family, the community, the travel, between everything, you just get overrun.
I would like to say one more thing, which I've learned with time, and I did not understand it when I was younger, is perfection is an illusion. So in the chase of being perfect and doing everything right, not only we end up stressing ourselves, it is not honestly necessary. As long as we're doing whatever we're doing with our best effort, it's fine.
Yeah. That one's a tougher pill to swallow.
I've learned that it's better to accept it than to chase perfectionism, because that induces a lot more stress, not only in you, but also people surrounding you.
It's true. No, it's very true. I catch it sometimes. I'm a recovering perfectionist. And so sometimes like this weekend, I'll be like, okay, we need to get ready for school. School's like August 15th. We're not even at July 15th, but somehow that deadline to me is here.
I know.
And so I started working on it this weekend, and then I was like, you know what? They're not little anymore.
Yeah.
The backpacks don't need to be embroidered.
Yeah.
All those notions
Oh my gosh.
of perfect things, they're gone.
Yeah.
At this point, you don't even have sovereignty over this. They control these
Exactly.
things. So just let it be.
Exactly.
It's going to end up where it's going to end up. Yes, handle it, but the stress doesn't need to be attached. And certainly because of the awareness we both have around stress and disease, why incur the stress in the first place if it's not necessary?
Believe me. I'm an immigrant. I immigrated to this country when I was 23. So that thing is very deeply ingrained in me, that you have to chase perfectionism and chase success, and you have to work hard till you really can't do anymore, which helps. But at the same time, I've realized brings on kind of a lot of stress around too. So I'm trying my best to balance it out.
Sure. So let's share who you are, because I didn't even explain yet who you are. So you are Dr. Priyanka Grover. You are a practitioner. You are someone who owns an incredible practice here in South Florida called Win Health, which is a center and space for women's health. You dive into breast ultrasound, diagnostic, mammography, and all these things. And when I first met you, I thought to myself, she does mammograms. She probably doesn't believe in thermography. All my friends believe in thermography because we're those crunchy people, and I'll probably never be friends with this girl.
Oh my gosh.
That was my first thought. And I had the thought, and then I'm a diplomatic woman, and so I was able to rally in my brain, and I was like, well, why don't you just talk to her and see what her perspective is? And I asked you, I said, what are your thoughts on thermography? Right. And you gave a great answer. You said, look, if you get on an airplane, you experience more radiation than you will in a mammogram.
Exactly.
And I thought, wow, well, I've flown 100 times.
Exactly.
So why am I making a big deal about this? Am I open enough to just understand more about this? So will you explain your background?
Sure.
What kind of background you have in medicine, and then why you started Win Health and what you do there?
Absolutely. So thank you for asking that question. That's deeply goes along with who I am. So I am a physician who is trained in diagnosing and we call it interventional procedure, intervening in women's health through the tools of radiology. So it involves not only X-ray, mammography, MRIs, ultrasounds. Unlike a conventional radiologist, I just don't sit in a dark room and never see a patient. Sure. The benefit of being a women's interventional radiologist is that I interact with each patient of mine. If I need to scan them, I am there. If I need to do a biopsy, I'm there. If I need to do an interventional procedures, I am there. And the good news is that there is so much medical advancement in the techniques and procedures that we use lowest possible radiation, as you express the concern about it, and we can have further discussion about it, in obtaining the maximum diagnostic potential. It's a very customized plan, which I offer to my patient. It's not one size fits all. It's not like you walk in, you get a mammogram and MRI, and ultrasound. Everybody is different based on their age factor, family history, risk factor, based on their breast density, based on their genetic profile. There is so much more we customize on what they need for a screening. And that's why we're unique, because we're not just any diagnostic testing facility. We're very customized, and every woman is different, and they require a different plan.
Sure. You know, I had breast reduction surgery a year or two ago, and I share that very publicly because it was the best thing I did for my health. I have no neck or back pain. It's been life-changing.
You know, one thing I have to commend is you come out and open and talk about these things, especially from the cultural background you and I come from.
Sure.
Most people don't even want to discuss. And I think you benefit so many other women. Like when I was experiencing neck pain and I was considering reduction mammoplasty, not that I've taken the step yet, but I called you and you were so helpful. So thank you for doing what you're doing, because I haven't seen that in my environment, you know?
Yeah. And I think as women, if an educated woman who is using her best tools and her best decision makes a decision like that, that helps me look at the whole process differently, right? If she's my colleague, if she's in my community.
Yeah.
So for me, my health is a very big journey.
Yeah.
It's a lifelong journey.
Yeah.
I'm still learning.
Yeah.
I still laugh at myself all the time that I still have so much to learn. So thank you. I do share it just because I figure if it's going to help someone, like I went through a whole journey with my uterus a few years ago.
I remember you were out and open, and I commend you because that requires a certain level of self-assurance and courage.
Sure.
And as I said, I haven't seen that in my immediate environment.
Thank you. Thank you. Well, I went to your place to get a mammogram because we needed a baseline. They were like, you have no mammogram. You need to make sure you have one before you do the surgery so you have a baseline. I said, okay, there's only one place I'm going. I'm going to Dr. Priyanka's.
Awesome.
And so I went to your space. They were so gentle. They were so nice. It's not like the most fun thing on earth, but it also wasn't the worst. The team was great. They did want to do an ultrasound. They explained why. It all came out beautifully. We got to sit there and look at, the reading and understand it. And I thought, thank you. I feel very educated on the state of my health now.
Exactly.
Perfect.
So I'm not only a doctor, I also think like I put myself in patients' shoes. If I walk in a place and they're taking pictures of my inside, I want to see what it looks like. I want to know what's going on. Thankfully everything was fine with you, but there are women who are not. So when they have a finding, they have a mass or they have calcifications or they have some abnormality, I love to sit down with them, show them what's going on, tell them the plan, tell them the sensitivity and specificity of each test and possible procedure. And then we make a combined plan.
Sure.
And thankfully patients are really appreciative of it. And that's what the need of the hour is, to kind of have understanding of what you're going through, good or bad, and a combined decision on the treatment and management with the patient.
Right. So let's dive into the topic a little, just because, like I said, this is not my area of expertise. When it comes to breast health, obviously we're seeing a lot more health issues across the board. We're seeing rise in breast cancer, rise in all cancers. We're seeing more cysts. We're seeing lots more happening in the uterus. I think this is just a symptom of modern society. We're going to have more of this over time, period.
Correct.
For multiple factor reasons, which we don't even need to dive into. But the fact that it's advancing means that we as women need to be intelligent, committed, disciplined, consistent, and aware.
Correct.
Have self-awareness with our bodies.
Correct.
And I remember growing up, they were always like, do your own self-breast exam. And I was like, you are weird. You really want me to think? You want me to do that? You want me to remember that? Like, what is that? That's weird. Right. I would not do that normally. And I think by the time we have kids, it's probably when normally everyone's like checked out in a way we've never been checked out. Like, oh, you have fibroids. Oh, you have these things.
Yeah.
So can you share kind of your viewpoint on what is an ideal way? There's no perfect.
Right.
There's no right. Standards in medicine and these things shift. They change. Mm-hmm. But in this moment, from the perspective of medicine as you are practicing it, what are we supposed to do as women? Are we supposed to be showing up at your office by the time we hit 40, 45, and get that first one? Like, what is the ideal?
Right. So you're absolutely right. There is a rise in incidence and diagnosis of breast cancer. I won't go much more in depth, but I do want to touch that it is likely secondary to lack of physical activity.
Sure.
Somehow alcohol consumption, even if it's wine, which was assumed to be harmless, also contributes to breast cancer.
Wow.
I know.
I don't really want to hear that.
So recent studies have proven that any increase in alcohol consumption in women does slightly increase your risk of breast cancer in proportion to the intake.
Wow.
Including wine.
Okay. Yeah. All right. To all my ladies out there who like Chardonnay like I do, moderate yourselves.
Yeah, moderate. Moderation is the key. Yeah. And stress, lack of good sleep.
Sure.
Melatonin, as you must know, plays a huge role in our hormone fluctuations and hormone balance. A lot of us are on the phone, exposed to that white light late in the evening. First thing you wake up is phone. Last thing you sleep is with the phone. So honestly, that white light exposure is not helping melatonin or anything in your, which nature intended to be. Sunset usually in most places, as nature intended to be, was after 7 or 8 p.m. The way we evolved for 100,000 of years is no light, no white light especially, at least 8 to 9 hours of sleep, which we hardly get, and fast-paced environment, lack of stress in that time, more physical activity, more natural food. I mean, you are an expert about what we're intaking these days, but also understand there is even a slice of pizza these days will be different from what Italians were making 200 years ago. There's a lot more microplastics. Everything is GMO. Everything is, you know what I'm saying? So everything has changed tremendously. So when we ask ourselves, why is there increased incidence in cancer? there are so many levels just based on the lifestyle.
Sure.
Then also, we're diagnosing early because thanks to the new screening tools, we're diagnosing at a stage where it can be prevented, treated, diagnosed at much less complicated stage.
Sure.
So those factors are contributing, is why we're seeing it more and more.
Okay.
To answer your question about what should a woman do. So if you have, let's start as young as 20. If you have strong family history of breast or ovarian cancer, which can be seen in some genetic mutations, you should seek out at getting at least a basic physical exam and an ultrasound as young as 25.
Okay.
Okay, because if you don't have any strong family history of breast or ovarian cancer in immediate family members, and you're 30 plus, as you said, if you're undergoing any procedure versus some people who are undergoing IVF at that stage, they come to me, they seek, or if you feel a new mass or lump or pain or discomfort, mostly in age group between 30 to 40, if somebody is symptomatic, I'm talking about patients without family history. If this with family history, you should come to me sooner. Sure. But without family history, if you are symptomatic, like you feel pain, lump, mass, discomfort, nipple discharge, any breast changes, they come to see me. Or if the patient is undergoing IVF, breast reduction, breast surgery, plastic surgery, implant placement, that's when they get to see me. 40 and plus, if your average lifetime risk means you don't have any strong family history, you should be getting annual screening mammography. If you have dense tissue, that will be supplemented with breast ultrasound, but that recommendation can be done once you have the mammogram. So we don't expect our patients to know when they walk in what they're going to have, you know, obviously, because they're just being proactive, but it's our job eventually to guide them through from there. Yes, self-breast exam is recommended yearly. I kind of have made my morning shower routine every morning while I'm showering. One hand above the head, the opposite hand used and I look for painless, hard masses in the breast. If the patient experiences mild tenderness, pain, discomfort, it's usually secondary to hormone changes, menstrual fluctuations, fibrocystic changes, sometimes because of caffeine, etc. But I get concerned when a patient comes to me and tells me I have a hard, painless lump, which is new. That's when I'm worried.
Okay.
Mild pain, tenderness. Oh, it's hurting. It's sometimes burning pain, shooting pain. It goes away. It's cyclical, likely hormonal.
Sure.
I'm not saying 100%, nothing in medicine is 100%, but 90% it's benign or non-cancerous.
Okay.
So that's kind of a guideline of where to begin with.
That's a great explanation. So it's almost the opposite of what you'd think.
Exactly. It's counterintuitive.
It's counterintuitive. So it's more dangerous in a sense. Because if you found
Correct.
something painless, you're like, oh, it's nothing. Versus if it's painful, you're like, oh, I should go see someone. And the opposite is true.
Correct.
Got it. Well, thank you for that. That makes a lot of sense. And I think a lot of us might not even know our full family history.
Yeah.
In my case, I know a lot about my family's history with diabetes just because it very directly impacted my life.
Yeah.
And then later when I did go to do surgery, I was like, oh, yeah, I did have one aunt and she did have breast cancer. Didn't think much of it. But yes, it is part of the history of why someone would come to you.
Exactly.
And recently I had a friend who was suffering a bit and I sent her to you and thank God, knock on wood, it was benign and it wasn't a problem. I was so grateful. And so, as you are working with women, I'm so glad you brought up these issues of what's the causes. You brought up exercise. Sure. A lot of us need to exercise. There's so much science on it, but making the time for exercise sometimes is not number one on everyone's priority list.
Not at all.
For me, exercise is mandatory. If I don't exercise, I'm not the nice human I am. it's a mental health thing before it's anything else. It's also a diabetes prevention tool. So
Correct.
I've built it into my life as the most mandatory thing.
Correct. It's not only diabetes prevention, it's cancer prevention. So many cancers, forget about breast, colon cancer, breast cancer, bladder cancer. They're all related to your exercise and weight.
Wow. Wow. So do you even see within your own practice these patterns of like more obese means more likely?
Correct. So there are different varieties of cancer, but let's just say broadly or grossly, there are two major categories. One is cancer which is receptive to estrogen. It's called ER/PR positive. So it means it has receptors for estrogen and progesterone. Okay. One type of cancer subset is ER/PR negative, which means irrespective of estrogen, it's not sensitive to estrogen. Okay. Now, what makes more estrogen? Fat cells. What increased body fat, increased body mass index, all that contribute. Even men who have increased weight make more estrogen. Okay, some sort of drugs like cannabis, marijuana, they contribute to increased estrogen production in the body. So all these, what they cause is there's always an excess of estrogen in somebody who's significantly overweight. Your body cells are constantly getting exposed to it. Your breast cells, which eventually down the lane, they are more prone to developing estrogen receptor positive cancer cells. So ER/PR positive cancer cells, I see mostly in women after 50s who are overweight, diabetic, obese, have other risk factors like heart disease. ER/PR behaves completely differently. So we're still trying to solve, because ER/PR negative is a very aggressive type of cancer and usually occurs in younger women, 30 to 40. And it multiplies pretty fast. It metastasizes pretty fast. So that's a separate subgroup, and we're trying to that requires more aggressive treatment like chemo. The ER/PR positive, which occurs in more later age group in females who are more prone to other estrogen excess situations, is easier to treat. It's more responsive to surgery and chemo if we need to go to chemo route. Sometimes they don't even need that route, So this subset, ER/PR negative, is more into genetic, more surprisingly I've seen in females who come in with ER/PR negative tumors. And it's been consistent, not that we have a conclusive study yet, or maybe there are some, where I talk to them and I'm like, was there anything in past 2 years? And most of them are like, oh, past 2 years was stressful. I underwent a divorce. I underwent mom's loss or dad's loss or someone significant in the family. I had a very stressful IVF. So somewhere stress is a leading factor in switching. Right. These genes are not able to take it and they switch, So a lot of research goes into it, but yeah, body weight does contribute.
Yeah, thank you for that. This is why I love talking to practitioners. This is the whole point of the podcast. I have conversations like this with brilliant people like you every day, and nobody gets to hear these things. Yeah. And they just think, you know what? I'm doing my best. Yeah. I'm doing my best. I'm living my life. Yeah. I'm busy with the laundry and the kids and the this and the that. I hear you. Yeah. There's a lot of stuff. My house produced a lot of laundry when I had food poisoning last week. I get you. But if we're not going to invest in the things that matter, the punishment later, that like gavel that comes down later is so hard. I don't want it for anybody.
Nobody.
And
True.
You sit there and see it all day in your office.
True.
What you just said is profound. You said excess estrogen possibly caused by excess fat in the body, can be caused by other things, but excess fat and obesity is a leading cause of this one type of cancer because that estrogen dominance is there. Part two, there's this other one. And you're not saying I found a scientific study and I'm proving this to be true, but this is the gold that can always be mined if you actually get the time to talk to a practitioner like you. You've been doing this a while.
Exactly.
You've been doing this for years, day in, day out. I know how hard you work. You are in your office 5 or 6 days a week, seeing women all day. And if you have that data set of knowledge in you, I have a very weird data set in me as an Ayurvedic practitioner. I can tell you all sorts of data sets I've been able to
accumulated over time,
conclude based on all these people who I've met. But I saw this point that you're making back when I worked at Canyon Ranch in the Berkshires. My first job out of college, I worked for Canyon Ranch.
Amazing.
I was like, I'm going to own a destination spa, and this is how I'm going to change the world.
Oh, wow. Canyon Ranch. I'm in love with that place.
Me too. Yeah. I would love to have the budget to go there every quarter and just chill and relax and get reset, right?
I'll come with you. Take me with you.
I think that should be a job I get to have, me and 10 women all the time, right?
Yeah, 100%.
But I worked at Canyon Ranch, and my job was in program coordinating. And so I had this job where people would come in, and my job was to build their experience.
Right.
And book between the exercise and the yoga and the classes and all the practitioners what they needed.
Right.
And the number of people who came in who said, I just went through a divorce and I just got diagnosed with cancer in the last year. My mom died. I just got diagnosed with cancer. If you saw how often that was.
Yeah.
And then in 2018, I stayed in a place locally called Hippocrates Health Institute. Same thing. If you talk to the practitioners, they said, we have a whole team of psychologists here because we know that the leading reason why people are having these issues is they're lonely.
Stress.
They're having these horrible stress events in their life, and stress will flip your genes. It'll flip on different things in the body, and all of a sudden you're going to manifest disease. What's scary about what you just said, because you took it really a lot of steps further. I haven't interviewed someone who deals with cancer like you do. Stress will flip. I talk about light switches. It's like flipping light switches. But to develop a cancer that's so aggressive, that's the word you used.
Correct.
That's harder to deal with and harder to treat.
Correct.
I mean, that's like waking up one morning and your whole life got flipped over.
Correct.
You know?
And unfortunately, it's happening. I do feel it requires way more research than what we have right now. But we call it triple negative tumors. Young female, super aggressive, mostly blamed genetics. But again, understand our genes are fighting every day at minor level. But there comes a point where they get overturned. Yeah. And chronic stress is the major contributor.
Yeah. It's so funny. It's not funny. It's in my office. Maria and I sit across from each other every day like this. This is what my office is like, and it's bright and happy. And we both have this conversation all the time. We're here to build great things, but we are not here to incur so much chronic stress along the way that while building a health company, we're destroying our health.
That's a good point. That's such a good point.
And as practitioners in medicine, I sometimes see that you guys are not given that same space.
Correct.
To actually take care of yourselves.
Correct.
And I'm married into medicine. I see it around me all the time. And I just think it's not fair.
Correct. And I think we also, not only the medical system and it's the way it's structured right now, but also medical professionals are the worst patients. We've heard it all the time, right? They don't even hesitate because we are taught in a certain way that you come the last. Your priorities come the last. You have to do, okay, these things have changed now, but when I was training, you have to do a 30-hour call. Oh, how am I going to, that comes the last. So you're trained, you're conditioned to be like that. And I not only deal with patients, but I also deal with women physicians who are my patients. And so many of them were diagnosed with triple negative cancer in their 40s. Every time I had this deep conversation with them, we came up with, the last 2-3 years, I opened my own practice and this happened and I have a divorce or something. And here where I am, it does lead to some women kind of taking a step back and being like, okay, something gotta give. Like, I need to change my trajectory of where I'm going.
Sure.
Maybe this is an eye opener. Unfortunately, for some women, it's still, even if they understand, they can't do it because finances, being a single mom, or whatever their situation could be.
Sure.
So you're right. Awareness, education, and implementation and self-discipline is what we need to start even before, God forbid, this happens to any of us.
Sure. And I think in modern day society, like we said, just like cancer and disease is a symptom, is what's on the way because of all of modern society's things. In the same way, I am not going to change my behavior too much, obviously, with a diagnosis like that. I could. But in this moment, I laugh at myself because I want to do what I want to do.
Correct.
And it's going to incur stress.
Correct.
But
we are ambitious people.
Yeah.
Correct.
So it's like, how do you walk that line in life of having your ambitions, wanting to create great things, wanting to have a beautiful, healthy family, wanting to have a great life, and wanting to have an excellent career, and balancing it? And I think there's a way. I'm an optimist, so I believe there's a way. And I think it just involves the yin and the yang.
Yeah.
Exercise has to be prioritized within the construct of what we're creating.
Yeah.
Sleep, like you said, melatonin production. I'd love for you to dive into some of those topics a little deeper, just because I say them all the time.
Yeah.
But maybe coming from you, my audience will sit there and say, you know what, Dr. Priyanka said that I need to put my iPhone down 30 minutes before bedtime.
Absolutely, probably more, but it's hard to practice.
Yeah. So just go over that a little bit again, because you said exercise, diet, chemicals and toxins in our food. You said melatonin production, sleep, hormone fluctuations. And then we haven't even gotten into the big topic, perimenopause, menopause, and all those big transitions.
I know. Tell me about it. But before I go there, I still want to go back to how do we balance all this, being ambitious, people who want to do what want to do and still not get stressed and still not get the side effects of being stressed. I still will go back to some basics which you had pointed. Discipline is very important. Perfectionism is an illusion. We gotta accept it at some point. Yes, we're ambitious. Yes, we're gonna do, and things are gonna not always go by and we have to accept it. I've learned to accept. I have this perfect state of mind in my head when I started my practice. It has to be this way, has to be that. And I realized I was just creating more stress for myself and my staff and my family members, So somewhere, yes, we put in our best effort, but if it doesn't always go perfect, that's okay. That's fine. Let it go. Thirdly, mindfulness again, being present where you are, truly giving your best and enjoying. There's a word in Sanskrit called ras. You enjoy, it's like a juice you drink for pleasure. Like enjoy, have that flavor of what you're doing genuinely, rather than you're sitting here thinking about what was happening before, past, or what's going to be next, future, ruining the present.
Right.
Now going back to your question. So talking about diet, melatonin, perimenopausal, hormonal fluctuations. So let's talk about melatonin for a second, because it's inevitable, at least in my field. Routines start from the morning. You face the phone. There are a million messages for everybody. It's not even like, there was a time when phones were wired to the wall.
Yes.
And humans were free. Now humans are wired to the phone, even though phones are free from the wall. You know what I'm saying? Like, we are now in shackles because we're always carrying this mini monster with us everywhere. I haven't seen a single person living a happy life without iPhone these days. In fact, I saw somebody at Starbucks the other day. Everybody, you just glance around, everybody's on the phone. This person's sitting, just sipping coffee. It was so abnormal sight. You're surprised somebody's actually sipping their coffee without looking at iPhone.
Yeah.
So it requires a great amount of self-discipline to say, and why are we saying that? Let's put pressure on that first. So when you're experienced to the white light, which is very strongly coming, especially when you're in dark, looking at any screen, it's actually called blue light. Blue light, not white light, blue light. What it does, not only it affects, so your body is gradually, as the nighttime is approaching, releasing certain hormones to put you in a calm status, to, trigger your REM sleep and NERM sleep. And that's the time when your growth hormones and all de-stressor hormones are released, your insulin and blood sugar. I mean, it's such a complex, our bodies are amazing. The work they put in for us, and we just, we just trash away all the effort. But all that, regulation of blood glucose, regulation of estrogen, progesterone, regulation of glucagon hormones, regulation of melatonin hormones, all that process is about to kick in when you're going to bed. And guess what we did? We stared at the screen till 11:30, then fell asleep, and the phone is right next to us. We talk about radiation all day. that also is emitting some sort of low dose radiation to us at nighttime, which we truly do not need. It's contributing to not only increasing stress levels, but some sort of genetic mutations or anomalies as a cumulative dose if we let it happen all the time.
True.
Especially with kids around us or in the same room or kids being, exposed to the gadgets. It's also interfering with their hormones and their development. So it requires a great amount of discipline to tell yourself, okay, I'm going to set up a screen time limit for myself and I'm going to strictly follow it. I'm going to put a screen time limit for my Instagram and Facebook and I'm going to strictly follow it. And I'm going to put my phone away 1 hour before I go to bed because I need all those corrective mechanisms to kick in to keep my body in a good state.
Totally. Oh my God, the discipline
I know it's
part.
so hard. It's so hard.
The discipline part's hard. I laugh at myself because I saw something the other day that was like, you could put something to restrict your own use on your phone.
Yeah.
And I was like, what? You want me to restrict my Instagram use? Do you know how much I'm on Instagram in a day?
So what I've done is I've given the passcode to someone, whoever, my husband right now, and I feel awkward asking him, hey, can you enter my passcode so I can get more access to whatever? So I don't do it. So that's kind of a self-limiting way to limit my social media use because it's this ocean in itself. Once you enter, you see an ad, you see a reel, you see a TikTok, and something always engaged. That's how they're making money, right? They need your time. Right. But who needs your time? Your body.
Yeah.
More than that.
Your body, your brain, your children, your family, your home, your life, your fitness, everything.
More than them. Yeah. More than Facebook and Google, they need your time. So it requires a certain sort of self-discipline.
Sure. That's actually a genius way. Give someone else in your home the code, kind of like we would restrict our own children.
Yeah.
Because in a way, our own mind is hard to control.
Correct.
Lately, I've been having a conversation with my mind every morning. As part of my morning meditation, I meditate real quick in the morning. I'm like, you have to sit to meditate. But when I sit to meditate, I say, mind, you are not a monkey mind today. This is me, the intellect, speaking. I'm trying to control.
No, that's great.
And I'm like,
that's
monkey
great.
mind.
Those are great ideas.
We are not going to run 200 miles an hour all over the place. We're going to focus. Granted, I'm going to get to my office today. I can't promise focus, but I try to just start narrowing my mind into, hey, follow a plan. Yeah. And social media, I can easily tell you, is the one area of my life that's a huge time suck.
It does. And you don't realize it till you've seen yourself. And you know what? I challenge every woman I know in my circle, there's a way to check how much time you spent on this app versus that app, and you'll be surprised by the results. Sure. My kids showed it to me the other day, and I'm like, oh my gosh, I didn't even know I was using this much till I saw it, the numbers, Yeah. The other thing which I have found very useful is, and I never, coming from a land of yoga, I was not that much into yoga. I was more into kickboxing, Bollywood dancing, Pilates is okay, but yoga I had not ventured into, maybe because the yoga I was doing here was not really what I am doing now with true yoga. Yeah. So I started with breathing exercises when it was kind of a time period. It was a little stressful for me. And the amount of de-stressing 10 minutes of breathing exercises did for me, that pushed me to do more and more yoga. And the moves I'm doing at yoga are not just downward dog, upward dog. They are called sukshma asana. Sukshma means very micro movements. So what they do is not only they open up like the intercostal muscles in your ribs, your breathing muscles, your facial sensory and small parts, small muscles of the body. Sure. That gives you that amount of stretch and relaxation which you had never experienced before. I'll give you kind of more detail on it later if you want, but it was really helping me to minimize my stress. So breathing, yoga, exercising, and I know there's so many more, but I've learned one more thing: surrounding yourself with people, friends especially. I think you can choose your, relatives sometimes, but friends and colleagues who are genuinely uplifting and happy for you makes a huge difference in your basal stress level. Sure. Obviously, it comes from who you deal with all the time, your spouse, children, parents, but them as well as the surrounding. So that and mental health. I mean, honestly, Human beings are so evolved in terms of the power our emotions have on our health. Like example, there was a very good close family member, very old elderly couple, 80 plus, very much so in love. Unfortunately, wife passed away. The husband passed away within a month or so. So the emotion plays such a huge role on your health. He was grieving, he was devastated, and then boom, he just had to go. You know what I'm saying?
Right.
So eventually it's all in here. If we have good discipline, good effort, good courage to control here, a lot can be controlled down there.
Right. It's a very empowering thought. I mean, when it comes to our health, what you're saying is, guys, you have the power.
We do. We absolutely do. And, what's the name of the Stephen? I'm forgetting his name. Stephen Hawkins. Yes, exactly. The legendary Stephen Hawkins. He's not able to use his body parts, but the amount of impact he's created in the entire world just by his brain. So human brain is...
it's a very powerful thing.
Very powerful. Correct.
And it's interesting. In the pandemic, I saw you were talking about community and exercise and movement and yoga.
Yes.
And you invited me, and I haven't been yet.
We have to do it, yes.
Yeah, but you created a little group, a little free circle where can you share a little about that and what kind of your intention was?
Yeah, that was amazing, because here's what happens. Our life starts with kids, work. Okay, fine. We have to go to this party, as you said. Sometimes you're, okay, fine, we'll do this. Or some activities for birthdays. But you never really... Or some people do, or I was not doing it enough at that time. I wanted to make an environment where like-minded, supportive women came in together and did some sort of physical and mental workout. So not only we used to do workout, and I love Bollywood, my passion towards dancing on Bollywood. So not only dancing with your heart, but also meditating. We used to meditate. We used to uplift each other. Somebody may be just going through something, and we would just kind of create that environment where we'll just say some words to bring up each other. And it was an amazing experience. I'm going to restart it by end of the year again. And then hopefully we're going to do another full year of that. I would love for you to join.
For sure.
And it's completely free, no charge at all.
Yeah, no, I think it's great. It's so cool. You have this practice. You're about women's health. Everything you deal with is women's health. You bring this awareness to this notion that we are making active choices as women that are impacting our health downstream, that you're seeing so clearly to be catastrophic, and you're with love and care and patience and presence handling it with people. But you also have all these other facets about you, and that's kind of what I wanted to share. Is you are into Bollywood dancing, and you're into music, and you're into just living this passionate life, and you made that time to carve out to create a space for uplifting yourself and the women in your close community.
It was an amazing experience, and I would love to restart it again.
Mm-hmm. Awesome. Nice. Well, do you have any fun plans, anything exciting, anything new coming up with Win Health, with your center? Will you share where it is?
Sure.
Anything else you want to share with our audience?
Sure. So right now we're located in Sunrise Plantation area. We're conveniently located close to University Drive, and it's I have gotten such a positive response thanks to my it started with just friends and family knowing about it, but a lot more patients and referring physicians. So it's been very positive. I'm expanding to a second location close to Coral Springs, awesome. North Broward. Yeah, Parkland, Coral Springs area.
Nice.
So it's just to expand the location services so that more demographics are exposed to it and more people know about it. It's exciting.
Yeah.
But at the same time, as you said, we keep pushing ourselves. But I always remember, and this conversation was so helpful to kind of remember the basics that, yes, we can run fast or we can drive fast, but we cannot forget to put gas in the car. We got to, fuel ourselves to be able to run that fast.
Yeah, absolutely. If I always say, treat your body like a Maserati.
Yeah. That's an amazing saying.
Treat your body like a Maserati. Because if you had a Maserati parked out there right now, you wouldn't go build a second location without putting gas in it, right?
Exactly.
You have to keep gas in the tank. And
True.
that's really the message you've been sharing with us all day, which is, look, we have to invest in our health. We have to put in the work. Because otherwise, when we go for our annual checkups, which include this annual checkup with you, then we're going to get news that we don't want to hear. And
Correct.
so it's important as we're seeing so much happen, and also stress management. So the iPhone thing was interesting, not to speak just to iPhones, all phones, but having the space at night for just 30 minutes, that's one easy take home today.
I know.
30 minutes before bed, can we just use our discipline, put that phone down, choose instead to pick up a book or whatever we want to do to relax that's not on the phone. It's possible. We used to do
Skincare.
Talking
to my kids.
Self-care.
I know.
Yeah, just anything to wind down. Music. I mean, there's different things. Yeah. So that's one easy habit to pick up. Involve more exercise in your life.
True.
For us, we just got a treadmill. We realized no one wants to Peloton in our house. We're going to do a treadmill instead.
Really?
So I did 20 minutes of walking today.
Great.
I told the kids, my son has to walk 2 miles, my daughter has to walk 2 miles. I was like, this is homework, mandatory. If it's too hot outside, do your job. Yeah. And then I was like, well, I didn't do my job. I need to go do my job.
Yes, exactly.
Right? Easier to prescribe than to do the work.
Exactly.
And prioritizing sleep, like you mentioned.
Yeah.
Awesome. Yes. And again, just bringing forward that mindfulness point you made, I think we're so lucky that coming out of the Indian background, we have yoga as yoga's birthed from India. Ayurveda's birthed from India. Pranayam, breathing techniques are birthed from India.
Exactly.
Pranayam, exercise, all these things, yoga, they're free.
True.
We can all take 10, 15 minutes a day.
Every day.
Somewhere and do it.
Absolutely.
And that practice alone, I find, builds stress resilience. And if we have stress resilience, then we have the ability to tolerate not just the stresses of daily life, but the additional stresses we put on top.
Exactly. And then also things will go wrong in our path. There's no, as Buddhism's saying is, there's nobody devoid of, even if it's rich or poor, things are going to go wrong. And that's okay. To have that expectation, acceptance that that's okay. Eventually it's going to stop raining and sun is going to shine.
Right. No, it's true. It's true. And one thing I learned a long time ago, I was in college and I learned stress causes diabetes. I had always thought obesity. So I was like, okay, I will always control my weight. I will keep that as a focus. And then I learned sugar, and I trained myself. Sugar's poison. You can have salt. You can have crunchy. You will give up sugar. So I did that act in college. I gave up soda and a lot of things very deliberately. But then I saw that stress could actually cause it. And I thought, okay, I have to shift my mindset. Correct. So when something stressful is happening, I've learned in my mind in that moment to flip a switch. Literally in my mind, I'll say, that's not going to stress me out. I don't accept that as stress.
Good.
And so kind of like what you were saying with perfectionism, if you look at something and it's going wrong, you can say, okay, that's fine. It's fine. It doesn't have to physically, mentally, or emotionally impact this being right now. Whatever's happening just is.
Yeah.
And you're right. It is a very kind of Buddhist philosophy. Yeah. And
suffering is inevitable. Everyone, no matter what age, sex, race, or socioeconomic status, suffering is inevitable. And it doesn't mean that we have to truly suffer. There are going to be difficulties, but it's an intentional decision if you want to truly suffer through it, or versus you say, hey, it's raining right now, or it's the difficult time right now, but good times are there, and just keep going. You know, it's our mindset, it's perspective. Yeah. It's easier said than done, but I've learned to, when I'm spiraling down, there are days I'm like, oh my gosh, and then I'm like, no, you know what? I got this. Right. It's going to happen. Things are going to go crazy around me, but I got to find that, as we say in Hindi, sthirta, like that calmness, right?
Mm-hmm. And hold that calm center.
Just hold it together and it turns out fine eventually. Like things go wrong and I'm like, oh my gosh, that's happened. And then I'm like, no, okay, just see the positive part. This is what you can do. This is what you cannot do. And that's fine. Sure. And honestly, after some times, it all turns out to be okay.
It does. It does. I think a lot of times we put so much stress on it and we didn't have to.
Yeah.
I think that a lot about my entrepreneurial journey because I complain a lot about it.
Me too.
And then
Tell
I'm
me
like,
about it.
You're going to complain the whole way. You're going to complain kicking and screaming as you build your company. Could you have looked at it differently?
Just change it. Yeah, it's like, it's going to happen,
Could you have
but that's
said,
fine.
I get to do this?
Yeah.
And I am going to win one day.
Yeah.
It just takes longer than I expected, and that is life.
Yeah.
Like, this is all a choice how we look at it.
Exactly.
So I'm going to ask you one last question before we wrap up, because I feel like we could talk all day long.
I know. I'm loving this.
So I didn't realize that you immigrated here when you were 23. Will you share a little bit about that story? Because it makes sense now. It's like, I have a very American accent because I was born and raised in America.
Correct.
So will you share a little?
Absolutely. So I was always interested in medicine. I did my medical school from Maulana Azad Medical College, which is a very reputable college in India. It's like Harvard or Johns Hopkins here. So I got, thankfully, good, deep foundation to my medicine background. And at that time, I was very interested in radiology, and the most advanced techniques were being offered in the Western world. So I decided to take a look. I told my mother that I would be applying to a few universities, and I'll be going there for a little bit and I'll come back. And she trusted me. She, at that time, surprisingly, coming from an Indian background, she trusted me. She's like, okay, do what you have to do, excel. I applied to University of Miami. It was the first university I ever applied to. I was immediately accepted. I went there. And everything shifted. I think it was meant to be. I strongly believe in destiny. I not only got immediate admission into the internship and residency, I also met my husband there, who was already working at UM. Okay. After I was doing residency, my kids were born there. I never lived anywhere else other than Fort Lauderdale or Miami, although I've traveled the whole world. But I think it was calling me. It was so meant to be. And thankfully, one after another, they received me very well. I was greeted with success. Nice. So I had an amazing journey starting from New Delhi to Miami, nothing in between. And after finishing my residency, fellowship, and everything, I took a leap of faith and started my own practice. And somehow, even though other clinical specialties like ortho, primary care, and telemedicine, they have but radiologists in today's world do not have their own clinical practices. Radiologists are either a group working for a hospital or groups are owned by some firms, medical firms. So it was kind of a dinosaur never heard of. And I was, I'll be honest, a little nervous.
Sure.
But thankfully, as I said, it was well received. I believe if you have a positive, if you're sure that it's going to work out, and if you give your 100% best, everything in life does work out.
Sure.
You just have to, give it to all what you have.
Yeah. No, I get you. So basically you're a unicorn. You're the only one
in
out
some
there.
ways.
You're the only one out there who's like,
yeah.
I'm still going to go do it myself and have my own thing and create this model for a standalone
women's imaging facility.
Yeah. That's amazing.
Yeah.
That you own. That's incredible. Yeah, I felt that way when I started Fusionary. I thought
you are a complete unicorn. And you require some level of crazy to be successful and to be unique.
Yeah.
And that's your quality. So that's a good thing.
It is. We can validate each other in that. We can validate each other.
That's what I'm
and
saying.
10 years from now, we'll be really grateful we were this crazy.
and right. That's why you break the barriers, Yeah. I would, if I had to go back and do everything all over again, I'll probably do everything the same.
Nice.
Yeah.
That's a beautiful way to end it. I wish for all of us that we can say at the end, I'm glad I did it the way I did it. I would do it all again the way I did it, because every memory along the way was worth it.
You're creating a life, especially Shivani, I'm very impressed, I have to say. And I'm not just saying it because we're here. I say it even when you're not there to other people too. You're creating a life which is so worth remembering. You're touching other people's lives. You are making a difference every single day with every podcast.
Thank you. Yeah. Thank you. I try. All we can do is do our absolute best in life. And for me, I was given so much. I have come from a very hardworking, very good family. And I thought growing up, my whole job is to leave an impact. I don't know how it'll be.
Yeah.
Now I feel lucky that I know what the impact is. It's through Ayurveda, through educating and through teaching. So I get to do that. And so that's why when I meet someone like you, I'm like, yes, fellow practitioner out there changing the world. So thank you so much for being on the podcast today.
Thank you. Pleasure is all mine.
I loved getting to connect with you. I hope our audience learned so much about breast health, women's health, mindset, overall, the perspective we can have around our health, and all the ways that we can build ourselves to have this incredible life that we design.
Yay. Cheers to us.
Cheers to us. Thank you.
Thank you.
Thanks for joining me for this episode. Check out our sponsor, Fusionary Formulas, the potent turmeric supplement used by doctors around the U.S. for patients with pain and inflammation. www.fusionaryformulas.com. I'm your host, Dr. Shivani Gupta. For more, visit shivanigupta.com. Subscribe to this podcast in Spotify or Apple Podcasts. Click the follow button or subscribe in any of the apps that you use. That's all I've got for you on the Fusionary Health podcast this week. You have the power to transform your health and achieve vibrant health starting today.